Good evening to all. Myself, Dr. Gokul Prasannan, consultant nephrologist at renamed city, Kochi. Today, I'll be discussing about pedal edema as an indicator of chronic kidney disease. So, let's explore what pedal edema is, its causes, and how it can signify the presence of chronic kidney disease. So, pedal edema, what it means? It's actually the swelling of the feet and ankles due to the fluid buildup in the tissues. It is an important sign of many medical conditions like CKD or chronic kidney disease, and often the first sign of an underlying serious health problem. Fluid leak from small blood vessels into the surrounding leg tissue. This causes swelling. Normally, what happens is that this fluid stays inside the vessels, but sometimes things go wrong. When the tiny blood vessels become weak and fragile, for example, like a leaky pipe, this allows fluid to escape into the surrounding tissues. This pressure inside the vessel increases, forcing even more fluid out of the tissue. It's like water gushing out of a leaky pipe. The balance of protein in your blood is also disrupted sometimes, which can cause fluid accumulation into the tissues. This makes it harder for fluid to stay inside the blood vessels. Another reason may be due to lymphatic blockage. When there is lymphatic blockage, excess fluid can't be removed and swelling builds up in the leg or lower extremities due to gravity. This leads to swelling. So these factors together cause the noticeable swelling, which is known as pedal edema. So the pedal edema can not only be caused due to kidney diseases, it is due to a variety of diseases can be implicated as causative. It can be due to chronic kidney disease. Second, it may be due to heart failure. It may be due to liver disease and certain medications or even malnutrition. In chronic kidney disease, what happens is that the kidneys are unable to effectively filter the waste and excess fluid from the blood. As kidney function declines, swelling accumulates inside the body. This causes swelling in the legs or lower extremities. So this swelling is mostly a sign of early sign of chronic kidney disease. So CKD, what is CKD? This is diagnosed when the kidneys are damaged or not working well, and this damage lasts for at least 3 months. When it lasts for more than 3 months only, we tell the patient has a CKD. This condition means that kidneys are gradually losing their ability to function properly. In CKD, swelling can happen for a few reasons. The main reason is that the kidneys might not be able to get rid of extra salt and water from your body. This causes the fluid to build up. Also, the kidneys might lose important proteins through urine, which normally keeps the fluid inside the blood vessels. So, this extra fluid can cause problems like high blood pressure and even worsening of a heart failure. As CKD worsens, swelling in the legs, feet, and ankles becomes more noticeable. This because the kidneys are not able to get rid of the excess fluid and salt. And here the main finding is that there is bilateral pedal edema compared to unilateral, or pedal edema is in a single leg. It may be due to other problems like lymphatic edema, or it may be due to infection in the leg like cellulitis. So to diagnose pedal edema in CKD, doctors, we may start with a detailed medical history, and we do physical examination to understand what might be the cause of swelling. We check for signs like whether the swelling leaves a dent while pressing. So this is called pitting edema. We also look for whether there is any tenderness or whether there are any underlying skin changes. So we also use lab tests to understand the kidney health better. We use blood tests like levels of serum creatinine. Obviously, high levels of creatinine indicate that your kidneys are not working well. Also, we also perform urine test like urine protein. When there is too much protein in the urine, that means there is problem with the filtration barrier of the kidney. So this urine protein as well as serum creatinine, these tests helps to identify whether the kidneys are filtering the waste and managing fluids adequately. In addition to these basic tests, we also do other tests to determine the condition of the heart, like an ECG, echocardiography. We also do a thyroid profile to make sure there's no thyroid disease. We do a liver function test to understand whether there is any underlying liver failure causing the edema. So these are some of the basic workups which we do. And for further diagnosis, we often use imaging techniques to get a better look at your kidneys. One such test is ultrasound. So an ultrasonogram can tell whether the kidneys are small or not, if the kidney's outlier is thin, or whether there are multiple cysts in the kidney. So all these indicate that the kidney has got some chronic kidney disease, which might be the cause of edema. We can also do a Doppler ultrasound of the kidney, which can help to assess the blood flow in the kidneys. We also sometimes use a low dose CT scan without any contrast to understand whether there is any stones inside your kidney. So what we do is, like, initially we take a detailed medical history along with a thorough physical examination, along with specific lab test. So all these are essential to figure out what's exactly causing the swelling in a patient. So this careful approach helps to catch kidney problems early. Also, it guides us to start treatment, also in the management of fluid overload, and thereby improving the overall health of the patient. So once we diagnose what is the cause of pedal edema, we usually proceed with the management of edema. This mainly involves the use of medications like diuretics. So these diuretics, there are many categories of diuretics. One is the loop diuretics, which include furosemide, torsemide, bumetanide, and all. There is thiazide diuretics. There is potassium sparing diuretics. So all these diuretics, they help to remove excess fluid from the body. Along with these medications, we also advise lifestyle changes like salt and fluid restriction, along with thorough and regular checkups to maintain kidney health. And the patient has to keep a close eye on the health and lab results. And also, this helps to detect any changes in kidney function early so that we can adjust your treatment better to manage the fluid balance and overall health. Lastly, I would stress on the importance of maintaining a healthy lifestyle, to do proper and regular exercise, take a balanced diet which is low in salt and potassium, and also do routine medical checkups. So all these are essential in managing chronic kidney disease and helps in reducing the incidence of complications like pedal edema and other complications associated with CKD. Thank you.